Where would you be without pain today? Would you be skiing? Hiking? At the park? How about climbing Machu Picchu? Or running at the beach? I don't know if you're in your golden years, your silver years, in your 50s, or your 40s. What I do know is if you're in pain, you're not as active as you want to be, and the quality of your life is diminished. You are not moving or grooving or living the way you would if you were pain-free. Imagine it, pain-free. Almost sounds like a dream, because when it hurts to move, we don't. Why? It's physiology. It's our body's way of trying to protect itself, like retracting your hand from a hot stove. But unfortunately, when we have chronic pain, it works to our disadvantage, because when we stop moving over a period of time, we get weaker and less flexible. Our joints become stiff and our pain becomes worse. We've heard the adage 1,000 times, use it or lose it. And the fact is, it's not just in our head. When we don't load our muscles and joints, they break down. The cartilage in our knees deteriorates if we don't bear weight routinely. It's just physiology, plain and simple. No judgment, just physiology. You see, cartilage gets its nutrition from the fluid in the joint, and it drinks it up like a sponge when it's compressed and then decompressed. When it isn't loaded regularly, it doesn't get the nutrients it needs and it breaks down. Pain begets more pain and stiffness and weakness, and the more inactive we become, and so on and so forth. We gain weight, we become stiff, we become more inactive and hurt more. Then our attitude gets bad and it becomes a daily struggle. Yuck. So here we are, finally at a point in our life where we have the time and the resources to enjoy life, to travel, to be active, to enjoy what life has to offer after we have worked a lifetime and paid our dues, but we are stiff and sore and activity becomes a daily grind. I know what you're thinking at this point. I've heard this pitch before. For my doctor or wife or husband or son or daughter. I've done exercises in the past. I've even learned to stretch. Ouch. In fact, I joined a health club after my doctor recommended I take exercise seriously. Use it or lose it, he said. Again. I've even tried ice and heat and non-steroidal anti-inflammatory medications. And you know what? It actually helped. I felt better. For a while. You see, I took a short break and my pain returned. Much faster than it went away. After all that work and enthusiasm, my unwelcome sidekick pain had returned. I felt like I hadn't made any real progress. I got discouraged and felt like I couldn't get over the hurdle. And you know what? You are right. You could not get over the hurdle. How do I know that? You still hurt. Let me be honest with you right now. I do not have a magical solution to your problem. Tricks are for kids. But I do have a solution which is about as close to magic as there is. Like electricity or flying or space travel was at one time. You see, your body and joints hurt because they are trying to heal themselves. Pain is one of the components of the inflammatory phase, the first phase of healing. It goes with pain, redness, swelling, and warmth. In the inflammatory phase, the body sends extra blood, nutrients, and growth factors to the injured site to initiate the second phase of healing called the regenerative phase. In this phase, the body forms new cells from pluripotential or stem cells to replace cells that are damaged or injured. New muscle cells form if new muscle is needed. New cartilage cells form if new cartilage is needed. New bone cells form if new bone is needed. And new blood vessel cells form if new blood vessels are needed. Finally, new cells remodel to align in proper position for maximum functionality. This is called the remodeling phase. So why do I have continuous pain, redness, swelling, and warmth? It's because your body is stuck in the inflammatory phase, like a car stuck in first gear. Your body doesn't have the capacity and the number of stem cells and growth factors to initiate and complete the regenerative phase sufficiently to get you out of the inflammatory phase. In essence, your pain is because your body is in a continual state of trying to heal itself without the workforce to get the job done. You see, our regenerative capacity is greatest as a newborn and decreases as we get older. Sound familiar? That's why it takes 2 weeks for a broken arm to heal in a 1-year-old and 8 weeks to heal in an 80-year-old. So what are we to do? What we are able to do today is to concentrate these healing elements from areas of the body where they are in abundance, such as fat and blood, and reintroduce them in great numbers to areas that are trying to heal. This is better known as PRP, or platelet-rich plasma, which can be used to heal injured tissue. This natural biologic solution called regenerative medicine is creating a new and golden age of medicine. It is the natural biologic solution to joint pain rather than medicine or joint replacement. Platelet-rich plasma is not new and has been used in professional athletes for the last 20 years. But like all advancements, it has been scrutinized, tweaked, and improved. And with proof of effectiveness, the indications have increased. Originally used in tendon injuries, it is now used in virtually every part of the body, including joints, tendons, intervertebral discs, bone, spinal cord, skin, and brain. Why? It works. PRP gained tremendous popularity in 2009 when it was used on Hines Ward and Troy Polamalu of the Pittsburgh Steelers. Both sustained injuries 2 weeks before the Super Bowl, received injections, and had miraculous recoveries, going on to play and win the NFL championship. Shortly thereafter, Takashi Saito, a Los Angeles Dodger pitcher, received the treatment in his elbow and avoided season and potentially career-ending surgery. Following this, Tiger Woods received a series of injections to his knee. Since then, platelet-rich plasma has been used in orthopedic, plastic, maxillofacial, cosmetic, neuro, and podiatric surgery, and in virtually every other specialty dealing with tissue healing. It has stood the test of time and is an accepted treatment modality recognized, scrutinized, and monitored by the American Academy of Orthopedic Surgeons, the most critical governing body of bone and joint treatment. How does it work? Let me show you. First, blood is drawn from the donor and placed in a Harvest proprietary dual-chamber decanter. The sample is placed in a centrifuge and spun to separate the blood components according to their density. In the first spin cycle, the heavier red blood cells separate from the lighter plasma, and the lighter plasma is decanted to a second chamber. In the second spin cycle, the separated plasma is further divided into its three components: platelets, white blood cells, and platelet-poor plasma. Finally, after removing excess platelet-poor plasma, the platelets, growth factors, and white blood cells in the buffy coat are then resolubilized to form the injectable concentrate. If fat is required for greater stem cell concentration, adipose cells are harvested by way of subdermal liposuction performed with local anesthesia. The adipose cells are then separated from red blood cells, oils, and lipids via centrifugation. Fat is harvested, cleaned, and purified because of its high concentration of stem cells and scaffold-producing proteins, then reintroduced into damaged tissue to revitalize the healing process. Now, before we go any further, I have to reiterate this is not a miracle cure or a standalone solution. This treatment, along with time-tested modalities such as ice, stretching, strengthening, gives the best chance of injury healing and pain relief. So are all PRP preparations similar? In a word, no. It has been determined by the International Cellular Medicine Society 3 factors determine the effectiveness of PRP preparations. 1. The absolute number of stem cells in the preparation. This is determined by the volume of blood drawn and the concentration of platelets in the blood. Commercial preparations are variable and concentrate anywhere from 3 to 10 times baseline. 2. Does the preparation contain white blood cells? White blood cells balance pro- and anti-inflammatory components of healing, protect against infection, and consume dead tissue, making way for new cell growth. 3. Is the preparation anticoagulated? Anticoagulation inhibits clot formation and allows physiologic activation of the PRP and release of growth factors at the target site. For these reasons, advanced medical specialists uses only the Harvest Terumo technology preparation systems. Harvest Technologies yielded the highest platelet concentration compared to 12 other PRP systems with 7 to 10 times concentration of platelets compared to baseline. In cases of moderate to severe arthritis, purified adipose tissue is added for maximum healing potential. Fat is an abundant source of platelets and growth factors and provides a natural scaffold for new tissue ingrowth. It is easily accessible and can be harvested as an in-office procedure. When both fat and PRP preparations are combined, a powerful healing and regenerative environment is created, and defects in the cartilage can actually be regenerated into new cartilage cells. This was shown as recently in 2016 by PAC, published in the U.S. National Library of Medicine and the National Institute of Health. So you say this is not a miracle cure? No, it is not. Even as tremendously powerful, cutting-edge fountain of youth-like shot this is, it is but one, albeit powerful, tool to relieve your pain and get you active once again. When coupled with traditional time-tested methods for pain reduction such as regular exercise, stretching, strengthening, icing, and activity modification, the results can be, well, life-changing. You can not only build years to your life, but more importantly, life to your years. What is truly unbelievable is PRP can be done in a single day, in fact, in about an hour, in the office with you completely awake. No hospital, no surgery center, no general anesthesia, no sedation. In fact, you will be able to drive yourself to and from the procedure because there is no medication that will affect your brain. Depending on your diagnosis and the severity of the condition, you may be required to use crutches up to 6 weeks to facilitate new cartilage growth. But this is not always the case. Your treatment will be tailored to your diagnosis, expectation, and lifestyle. All that is required is a discontinuation of all non-steroidal anti-inflammatory medications 3 days prior to the procedure, and the patient can have no clinical or laboratory evidence of a blood infection or a documented platelet disorder such as von Willebrand's disease, Wyckoff-Aldrich, or Chidiac-Higashi syndrome. So what is included in the treatment program? A complimentary 1-hour evaluation with a fellowship-trained orthopedic surgeon, including a detailed medical history, physical examination, radiographs, and review of all previous studies, including MRIs and operative reports. This evaluation is done to determine if you are a candidate for the procedure and are able to complete the post-treatment recommendations. This is a complimentary evaluation, one-on-one, all questions answered, hands-on examination with absolutely no obligation. If you are unable or unwilling to perform the appropriate post-injection course of action to get the maximum benefit from the procedure, the entire evaluation is completely free. Evaluations are performed at 1583 Main Drive, Fayetteville, Arkansas 72704, and are scheduled on a first-come, first-served basis. So I get it. You're saying, what's the catch? It sounds too good to be true. You're not giving me the whole story. Bring me back to real life. I know there's a downside. This is where it gets really good. You see, I'm going to double down. You might think I have no interest in the PRP procedure. I've read about it in the past and I think it's hogwash. In fact, I've seen it advertised on TV with free seminars with limited space available. Some advertiser blows through town and then they're gone. No follow-up care. No one-on-one treatment. There's a Q&A session, but all the answers are generalities. Or, I've asked my orthopedist about it and he says it doesn't work. He said it was a waste of money. He said I should live with the pain as long as I could, and when I couldn't stand it any longer, he'd do a knee replacement. Yeah, but it's my knee that hurts, and I'm not getting any younger. Great, a knee replacement. The problem is I don't want to have a big surgery with its inherent risks. I want my knee to be better now, without surgery. You might think I have no interest in PRP, but I'd like a free medical evaluation. That is your option, but I bet you've already had an evaluation, or 3. And you still hurt. How do I know? You're still watching this video. You might think there has to be a downside, possible adverse effects. That could not be farther from the truth. Because stem cells are taken from your own body, there are no allergic or immune reactions. Other than a potential infection, there are virtually no risks. In fact, because the preparation has concentrated white blood cells, it protects against infection and is less of a risk than a cortisone injection. Speaking of cortisone, why don't I just get another cortisone injection? It helped me a good 6 months last time. Why go through the time and expense of PRP? Here are 3 good reasons. 1. Cortisone is temporary. If the tissue does not heal by the time the cortisone wears off, it actually hurts more. 2. Cortisone doesn't promote healing. In fact, it does the exact opposite. It disconnects your body's injury from its natural healing mechanism by inhibiting proteins that regulate inflammation so your body doesn't know it's injured. 3. Cortisone weakens existing tissue. Because it inhibits protein formation, it weakens the existing tissue scaffold called collagen. So why in the world does my doctor give me cortisone? Because it relieves pain, albeit temporarily, and there are no better alternatives. Until now. PRP stimulates protein synthesis and promotes healing naturally by regulating cell migration, differentiation, duplication, and regeneration, creating new tissue exactly corresponding to your injury. So what is this worth to you? What would you be doing now if you were pain-free? Living life, enjoying each day with your loved ones, traveling, being active? You see, the beauty of this treatment is that it does not burn any bridges. You can always have that knee replacement thereafter. It's always waiting for you. But what if PRP buys you a year of activity, or 2, or 3, or 10? What is that worth to you? What if it cuts your pain in half, making it a nuisance rather than a disability? What if? A knee replacement isn't always the end-all, be-all. Many people continue to have pain following a knee replacement. Some people get infections or blood clots, and frankly, it's a disaster. But like I said, it will continue to be an option for you. What if you received no benefit from this miraculous PRP injection? What if all you got was the peace of mind knowing you had exhausted all options to relieve your pain prior to having major surgery? For some, maybe most, this alone would be worth it. So what is the cost? PRP injection using Harvest Technology 60 ml system with 10 ml yield platelets, stem cells, and growth factors is $1,600. This includes a complimentary evaluation, a pre-injection consultation, unlimited office follow-up for 2 months, and a detailed rehabilitation program for physical therapy, health club, and/or home. PRP and autologous fat grafting using Harvest Adiprep system producing 18 milliliters purified adipose tissue is $3,400. This includes a complimentary evaluation, a pre-injection consultation, unlimited office follow-up for 2 months, and a detailed rehabilitation program for physical therapy, health club, and/or home. So what do you have to lose? If you act now and schedule your appointment, you will receive a free copy of the ebook How to Avoid Knee Surgery by Dr. Robert Tomlinson. Act now, do not delay. Appointments are made on a first-come, first-served basis. There is virtually nothing to lose but precious time.